1. A community language aide is primarily responsible for facilitating communication between A. Doctors and patients. B. Teachers and school administrators. C. Non-English speakers and service providers. D. Public officials and reporters. 2. When interpreting for a client, a community language aide must A. Summarize the conversation. B. Add cultural context to make it easier. C. Translate only the main points. D. Interpret everything said without omission. 3. Confidentiality in interpretation means that the aide should A. Only share information with coworkers. B. Discuss cases during training sessions. C. Not disclose any information shared during interpretation. D. Tell family members to provide better help. 4. Which of the following best defines consecutive interpretation? A. The interpreter translates after the speaker finishes. B. The interpreter translates word by word simultaneously. C. The interpreter translates documents. D. The interpreter provides summary translations only. 5. During a medical appointment, a community language aide should A. Provide advice based on their own knowledge. B. Speak on behalf of the patient. C. Remain neutral and interpret accurately. D. Only translate what the doctor says. 6. The primary difference between translation and interpretation is A. Interpretation is more accurate. B. Translation involves spoken language only. C. Translation is written, interpretation is spoken. D. Interpretation requires certification. 7. If a speaker uses slang that the aide doesn't understand, the correct action is to A. Guess the meaning based on context. B. Skip that part. C. Ask for clarification. D. Substitute a formal word. 8. A community language aide should avoid A. Asking for clarification when needed. B. Making cultural notes when necessary. C. Expressing personal opinions during interpretation. D. Using terminology from both languages. 9. Which of the following is a sign of cultural competence? A. Avoiding sensitive topics. B. Stereotyping to simplify the conversation. C. Understanding and respecting cultural differences. D. Using only formal language. 10. When asked to interpret a technical term the aide doesn't know, they should A. Invent a similar sounding term. B. Omit the term. C. Inform the speaker and seek clarification. D. Switch to English. 11. The best seating arrangement for community interpretation is often A. Side by side with the client. B. Behind the speaker. C. A triangle so all parties can see each other. D. Facing away from the client. 12. Which of the following is most important in maintaining impartiality? A. Agreeing with the speaker to build trust. B. Avoiding eye contact. C. Keeping tone and content neutral. D. Dressing formally. 13. Active listening during interpretation means A. Repeating everything immediately. B. Memorizing the conversation. C. Focusing on the speaker, using nonverbal cues, and taking notes if needed. D. Interrupting to speed up the process. 14. An interpreter should intervene in a session only to A. Correct the speaker. B. Clarify language or request repetition. C. Summarize the dialogue. D. Change the subject. 15. When interpreting for children, the aide should A. Use child-friendly language without altering meaning. B. Ask the child to interpret for their parents. C. Simplify everything significantly. D. Skip complex ideas. 16. One ethical responsibility of a community language aide is to A. Influence the conversation. B. Share details with other agencies. C. Remain accurate and impartial. D. Prioritize personal beliefs. 17. Which of the following scenarios requires the interpreter to recuse themselves? A. A familiar topic is being discussed. B. The interpreter is related to the client. C. The setting is a courtroom. D. The client speaks the same dialect. 18. A community language aide should continuously improve their skills by A. Working only in one setting. B. Attending workshops and training. C. Focusing only on vocabulary. D. Using automatic translation apps. 19. Sight translation refers to A. Interpreting sign language. B. Interpreting a written document aloud. C. Lip reading and interpreting. D. Watching a video and summarizing it. 20. When interpreting for law enforcement, the aide should A. Explain the law to the client. B. Act as an advocate. C. Remain neutral and accurate. D. Answer questions on the client's behalf. 21. Which of the following is a barrier to effective interpretation? A. Familiarity with both languages. B. Use of regional dialects unfamiliar to the aide. C. Use of repetition. D. Maintaining eye contact. 22. Cultural brokering is best defined as A. Taking control of the conversation. B. Translating culture-specific jokes. C. Helping clients understand and navigate unfamiliar cultural norms. D. Giving advice during interpretation. 23. Which statement best describes the role of neutrality in interpretation? A. It is acceptable to give advice if asked. B. The interpreter should align with the client. C. The interpreter should stay unbiased and professional. D. It is okay to comfort the client with personal stories. 24. The Code of Ethics for Interpreters emphasizes A. Summarizing conversations. B. Building relationships with clients. C. Impartiality, confidentiality, and accuracy. D. Taking initiative in communication. 25. A community language aide is allowed to A. Translate and provide legal advice. B. Interpret only and not provide personal opinions. C. Discuss interpretations with friends for feedback. D. Rewrite documents into simpler forms. Community Language Aide. The Community Language Aide or CLA test is designed to assess the bilingual communication skills of individuals who assist in bridging language barriers within community settings, such as schools, healthcare facilities, and public service agencies. This exam evaluates a candidate's ability to understand, speak, read, and interpret both English and a target non-English language accurately and appropriately. It focuses on real-world situations, requiring test takers to demonstrate proficiency in tasks such as interpreting informal conversations, translating simple documents, and conveying information with cultural sensitivity. The CLA test is ideal for bilingual individuals who wish to serve as a linguistic and cultural link between service providers and limited English proficient community members. Here are the top 5 beneficial uses of the CLA exam. 1. Improved employment opportunities. Passing the Community Language Aide exam validates bilingual proficiency, opening doors to jobs in education, healthcare, social services, and government. 2. Enhanced communication with diverse populations. Certified aides help bridge communication gaps between service providers and individuals with limited English proficiency, ensuring vital information is understood. 3. Support for inclusive public services. Language aides promote equitable access to services by helping agencies meet the needs of multilingual communities, fostering trust and cultural understanding. 4. Career advancement. Certification can lead to promotions or specialized roles requiring language skills, adding value to existing job functions. 5. Professional credibility. The exam provides formal recognition of language skills, which strengthens resumes and builds trust among employers and community members.